Hey everyone, and welcome to the Coast to Coast Plastic Surgery Podcast. I'm your host, Dr. Caleb Steffen. Each episode, I sit down with leading plastic surgeons from across the country to explore surgical technique, clinical decision-making, and the artistry behind aesthetic and reconstructive surgery. Whether we're discussing complex cases, innovative approaches, or the philosophies that shape great surgeons, our goal is to elevate the conversation and help advance our specialty. I am very honored to have probably the most highly decorated, the most degrees, the most training of, I think, anybody we've had on the podcast to date, maybe anybody we'll ever have on the podcast, none other than the Dr. Earl Stephenson Jr., MD, DDS, MBA. Welcome to the program, sir.
Caleb, thank you so much for having me. It's a pleasure to be here. Yeah, I'm a glutton for punishment, basically.
Okay, well, I think we'll get a little bit into that. So first question, I just got to get Stephenson, are we related? I just got to lead off with that.
Well, I think it's a really good question. And I'll say this. It's very possible because I see the resemblance in the hairline. What do you say?
I don't know. I don't know. The spelling's different, but those things that could have gotten jacked at Ellis Island or who knows what.
Absolutely. Right? Absolutely. Right. So it's very possible. I think it's good. Yes, absolutely.
Okay, I'm going to say yes. Unless I have no proof otherwise. So for now, I'm going to say yes.
Well, I'm going to say yes, too, because we end up training in the same place for plastic surgery.
Fact.
There you go. So we're good. All right, brother, you ready to do this?
It's all settled. Absolutely. So tell us a little bit. We talked a little bit, but tell us a little bit about who you are, where you're from. Who is Dr. Earl Stephenson Jr.?
All right, great. Be happy to, like I said, happy to join you here.
Thank you
Caleb.
so much.
I'm from Virginia. I'm just a guy from Virginia. I grew up in coastal Virginia, Norfolk, Virginia. Some people say Norfolk, but it's Norfolk. And my father was in the Navy. He was born in a little town in North Carolina, 60 miles south of Norfolk. So we ended up settling there.
This isn't about me, but another connection. My dad was Air Force at the Pentagon. We lived in Manassas. How about that?
There you go. See, it's going to come full circle, and we're going to discover all kinds of family trees here.
Right. Anyway, go ahead. Sure. Sorry about that. I just had to throw that in there.
Hey, no deal. No big deal. So I grew up in Virginia, and just an average kid. My mom, dad, married for 60 years. Mom was a teacher. She taught geography and social studies. Dad worked for the Navy and then worked for the Civil Service. Didn't really know what he did. It was kind of priority. And so we really didn't know.
Need to know, huh?
Yeah, need to know basis. But I know he was on aircraft carriers all around the world doing their electronics, making sure those ships were, voyage worthy. So that's my parents. I was a guy who just was a, normal kid, grew up, loved basketball, played sports, played baseball, never had any aspirations, believe it or not, to be a physician first and foremost.
Okay.
And really no aspirations to be in healthcare for any reason. So I end up going to the University of Oklahoma for college. And I ended up choosing dentistry because I was a baseball player, like I said. And I got hit in the mouth by a baseball bat.
I saw this story. A lot of people probably haven't heard this one. This was wild.
So I was 15 years old. We're waiting for practice to play a lot of travel ball. I had a lollipop in my mouth, and I was sitting there with my glove, and a guy had a brand new aluminum bat, Louisville Slugger.
Oh, I don't like where this is going.
No, it's bad. It's bad. So he's swinging, I'm looking, and next I know he takes a full swing forward and a full swing back into my face. And it's like, oh my goodness. And it just so happened, my mom was at the beauty parlor across the street. I run across there, drenched in blood. She freaks out. She gets up, hair half done, takes me to the dentist, and I spend probably a better half of a year or so in the dental chair for multiple procedures, root canals, extraction, so on and so forth. So that whole experience, I sat back and I was like, this guy's got a pretty cool deal. He's got his own business. He seems happy. His wife is working in his business. And I was a young kid, so I was like, he's got some pretty girls. And so I think this might work out. So I might pursue that. So I ended up pursuing dentistry once I finished the University of Oklahoma.
That's cool. Are there any from your childhood, I mean, that is a wild introduction to medicine that no one would want, but pretty cool. Are there any stories? What about when mom and dad or brothers, sisters, uncles, cousins, when folks are gathered around? What are those stories that people like to tell about Earl? Anything come to mind on that?
Well,
Well,
I
I don't
mean,
want you to tell on yourself on
oh
all the
no,
stuff, but
of course, it's all good. So the story that comes to mind is unrelated to medicine. So this is
good,
the
even
story.
better.
So we have a family gathering or family reunion like we do in the South every summer down in hot North Carolina. We would go to my father's parents' house and all the kids and their kids would show up. And my grandmother was a great cook, as most Southern women
Mm-hmm.
are.
Yes.
And she was a fantastic baker. So she would make this 4-layer chocolate cake and she would make 2 cakes, one for 70 people and one for me. And that was
What? What?
what?
How do you swing
And
that?
that was the standard. No one was to touch my cake. That was my cake only, hands off. It was from the dawn of time, from when I can remember to I left for college and would come back infrequently. I don't know how I pulled it off. You ask no questions. You just go with the flow, and I enjoyed every bit of it. So when I get around my cousins, they go, and they call me Junie because I'm Earl Jr.
I was
So they
going to
call
ask
me
you about a
Junie.
little nickname, Junior, Earl.
So,
What are they? What was it, Junie? Okay.
so it's Junie. So they say, every time we go to family reunion, Junie gets his own case. I don't know how he did that, and they just go in on me and get all pissed off. But I was like,
Well, I got the
don't hate
cake.
don't hate the player, hate the
Hate
game.
the game. I
So
love that.
that is a story that comes to the top of mind all the time when you talk to my family members.
I love that story. That's a good one. Tell us a little bit. We know about your childhood. Tell us a little bit about the training process and how you got from point A to where you are now.
Great question. It was a really rocky road, to be honest with you. I kind of learned as I was going through. So like I mentioned before, I was interested in dentistry. And so I ended up going to the University of Oklahoma dental school, fantastic dental school. At the time, it was one of the dental schools that got you into clinic early so you can get hands-on.
Mm-hmm.
So I got in there, did well, and I didn't know what I wanted to do, but I wanted to do well in school, so I have options. So I thought I wanted to be an orthodontist. And so
Okay.
I'm cooking along. I'm in about third year of dental school and I'm bending wire, believe it or not. And my professor comes over, who's an orthodontic professor. He's like, there's no way you're getting in. There's no way you can't bend a wire flat. And we had to bend a wire so it was completely flush with a level surface. And if there was a slightest bit of gap, you didn't pass. And I never could get that wire flat. And he's like, there's no way. So I was like, perfect.
Sounds like somebody needs a phone call or an update now.
Well, fast forward, his name's Franz Courier. He's a fantastic guy. Fast forward, I end up being best friends with him. We go to his house. We sing karaoke. Great. He has all these license plates in his living room.
All right.
And we had a really good time. But nonetheless, I ended up doing a rotation with oral surgery. That was part of our third year kind of exploration year. And I really dug what those guys were doing. They were in the OR. They were physicians, but they weren't physicians. So I was kind of baffled about that. But they did all kinds of interesting stuff, such as facial fractures. They did benign tumor resections. They work, closely with otolaryngology, or ENT for your listeners who may not know that fancy medical terminology.
That's right.
And plastic surgeons. And so I really got, I was really intrigued of what they could do. And these were guys and girls who were dental school graduates or dentists like myself. So I ended up pursuing that once I graduated University of Oklahoma College of Dentistry, and I actually trained at the University of Oklahoma Health Science Center. Fantastic training. Now, I trained back in the era where there was not much oversight, which was good and bad. So I got to learn a lot of things by kind of, I hate to say, just experience. Let's put it that way.
Right.
And so I did that, and I was cooking along, and believe it or not, Caleb, I finished that in 1994, and I was really satisfied with my training. And so at 94, I could not find a job. I could not find a job at all. So I was basically without a job for about a year, and I lived in Tulsa, Oklahoma, and I would just walk around and go to dentist's office, general dentist, and take out teeth. And then I just said, this is not working for me. I don't know what the disconnect is. I'm well trained. I want to go back to Virginia. It's not working. But at that time, there was a big push in the oral surgery community of whether you should be dual degree, medical degree plus a dental degree, or single degree, because oral surgery was making a big push into facial aesthetic surgery. And I had some interest there, but I always wanted to make sure that my training was way above board so no one could question me. And so, long story short, I ended up making a chance phone call to one of my old dental school buddies who happened to be in Miami at the University of Miami. He says, hey, look, a lot of our guys who are training in oral surgery are going up to Eastern Virginia Medical School and getting their medical degree, and subsequently going to Johns Hopkins, where Paul Manson was, who loves oral surgery and craniofacial surgery type guys and girls. And they end up training through that program. So here's a pathway. I think you might want to consider that. So I did. I applied to Eastern Virginia, which happened to be about 10 minutes from where I grew up. So I went back home.
How fortunate is that?
Yeah, it was a good thing. I went back home and slept in my own bed that I grew up in. So it was kind of cool. It was really cool. And my parents really enjoyed that time that I was there. So I trained there and actually I only had to do 2 years, because they credit me with year 1 of dental school and year 4 of dental school. As you and I know, years 2 and 3 are really critical in medical school. Right. Not that 1 and 4 are not, but 2 and 3 are really critical. And I had to pass all the steps, 1, 2, and 3 before I graduated. So we did kind of a truncated or accelerated course. It was myself and another guy, and we finished that program. And so we had our, medical license, or our USMLE 1, the first exam. And so we needed to do an internship to get our license. And so I was still a little bit confused as to what I wanted to do. Should I do ENT? That made a little bit more sense, being that I was already an oral surgeon. I certainly wasn't going to do ER medicine or orthopedics. Right. That didn't really make sense for the time I already spent. So I was like, you know what? I really think I should do plastic surgery, because I like that they have a breadth, or they have a broad training spectrum. I'm really artistic, so I like to draw. I do kind of graphite pencils and things like that, and that's all something I've always done. And so I thought that was a really good kind of marriage. And then I actually did a little historical research in the European model. Maxillofacial surgeons, plastic surgeons, they're kind of the same animal. They're dual degree. They kind of have crossovers in their, in their practice. And so this was more of a European model. So I said, it makes sense. I've got that, previous training. I have some innate abilities. Right. And plastic surgery seems to lend itself to that. So let me see if I can move forward with that. So I ended up having to do general surgery, of course. So I did general surgery, and I actually matched as a preliminary resident. And for your listeners, what that means is I didn't really have a dedicated end to becoming a general surgeon per se. Right. Usually the preliminary years are usually 1 year or 2 years. And then you have to dedicate somewhere else, either urology or ENT or so on. So I did that here in Atlanta at Atlanta Medical Center, which kind of led the country. So we would like to say with laparoscopic surgery. So we did one of the first laparoscopic cholecystectomies, so on and so forth. And so I got in, I did really well. Again, a program that was really hands-on for day one. And so I did.
There's a theme there, isn't there? You like the hands-on stuff.
I like to get right into it. Let's just get to it. So I did that for 2 years, and they offered me whatever time I needed. If I wanted to do 4, if I wanted to finish, do whatever. So I ended up just doing 2 because I already had my oral surgery and my 1 year of transitional internship. So I applied to 3 plastic surgery programs. 3. Because I
had a pretty competitive specialty.
Yes, because I was living in Atlanta. I had a family. I couldn't gallivant all around the world, all around the country. That's just not fair to them. They've been through quite a bit, as you and I know. And so I applied to 3 programs, and Chattanooga was one of them. And it was actually my first choice. It was close. I've really felt that the guys and girls at that time were really down to earth, and I thought they were kind of I hate to use this term, a sleeper program.
Mm-hmm.
We got a great bit of training. Again, you dive right in, none of this
Yes.
hand holding, let me watch you, let's get to it. And so it fit that motif. And so I ended up applying there, and I ended up matching there, and kind of the rest is history.
Oh, that's fantastic. So to summarize, you have dentistry, DDS, then you do, and you practiced in dentistry for a time, and then you get your MD, and then you do an oral. How did the oral surgery part fit into that? Where was that in the scape again?
Yeah, so that was after dental school. I did oral surgery training. That's a 4-year training program. So I did that.
So you've already got 4 and 4.
I got 4 and 4. Then I worked for a year as an oral surgeon, and then I did 2 of medical school, and then I did 3 of preliminary surgery, if you want to say that.
Yes.
And then I did 2 of plastics.
And so what's the grand total on that?
I think the grand total, the last time I looked at or had to be asked about that, I think it's 9 after college. I think. Let's see. Let's do the math. 4 dental school.
8.
4 of oral surgery. That's 8. So it can't be 9. So then 2 of medical school. That's
10.
That's 11. So,
11. Okay.
No, that's 10. Yeah, 11.
10.
So 10. I'm sorry. I'm getting you confused. 10. And then 3 of preliminary surgery. So that's 13. And then 2 of plastic. So 15. My math
15 years. Holy smokes.
Years. Yeah. 15
Holy
years.
Smokes. And that's not even counting college?
That's not counting college.
19. Holy smokes. Well, this guy can save you, Dr. Stephenson can save your life 6 ways from Sunday, which is pretty cool, and make your life so much better. Math. Well, it's too many. It's too many to count. Oh, that's awesome.
Yeah, so it was an interesting route for sure.
Absolutely. Oh, that's great to hear about. So we're going to continue on in terms of important question along those lines. 19 years of training. What was the drive in all of that? Because there's some themes going through in terms of wanting to be well-trained, wanting to be respected for your training, nobody to be able to say anything about that. What kept you going for that? You had a family. What were the things that motivated you to make it through a very long, difficult, time-consuming process? I mean, we glossed over the hours that you spent in the hospital and training and working. What kept you going?
It sounds pretty rudimentary, but it was just an internal drive. I knew I could do more. Mm-hmm. When I was in dentistry or oral surgery, and then we did some great things, but, I always like to challenge myself. I took a course when I was an oral surgeon. I went up to New York to NYU, a microvascular course, before I decided I was going to go the plastic surgery route, because I knew I had to sew on 1 millimeter vessels. If I can't do that, then it's going to be difficult for me to complete a training.
Yes.
And so that was kind of, again, de novo. I say, look, I need to challenge myself. I need to figure out if I'm fit or right for this pathway.
Yes.
And so I did that. And so as I went along, I felt that, I had certain skill sets that I could maximize, certain gifts. And I kept pushing myself to be the best that I can be, and to fall in a lane that felt comfortable and native to me. And then, like I said, getting back to being very artistic, I felt plastic surgery really was the road to that end.
Yeah. Sometimes I'm surprised when I hear from my colleagues who are like, I can't draw, I'm not artistic. I love that part of plastic surgery. Does that, when you hear that, are you ever like, really? But plastic surgery anyway, you know what?
Yeah, I was like, how can you not see the end? I mean, I'm like looking at it like, this is what I would do. This is how I see it. I have it visualized as I'm talking to clients. So I find that a little peculiar, but there are different folks, different strokes for different folks for sure.
Yes. Very good. Looking back, would you do anything differently in that process? Would you reorder it, skip something, anything, or would you do it all the same?
Great question again. I would do it all the same, but I would do it more succinctly. Like I said, I kind of stumbled on the path as I was an oral surgeon and kind of thinking, what am I doing because I can't get a job? I didn't know there was a pathway for oral surgeons to go to plastics. So it took me a year or 2 to figure that out. That's a year that I've wasted. So I did the math again, and I actually did it correctly this time. I said, if I did it succinctly, how far along would I be? I actually lost 7 years, which is not a good thing.
Mm,
Trying to figure it out between the
mm,
destinations. So that's 7 years of practice. That's 7 years of stability financially. That's 7 years of time with your family that,
yes.
you have control over.
Hmm.
So it was a great loss. So if I had to answer your question more directly, I would definitely do it the same way,
Hmm.
but I would do it much more succinctly and
Hmm.
intentionally.
Yeah, that makes sense. During that long process, what was the hardest time, or what was either the most difficult period or most difficult, thing that you kind of went through during that?
Sure. Couple times. So I was already an oral surgeon. I was kind of working as an oral surgeon here in Atlanta. Been doing that for 4 or 5 years, buzzing out wisdom teeth and doing okay. I was not satisfied. I was not
Mm,
fulfilled, and that was coming home with me, and that's never a good thing.
okay.
And so a difficult time is where you sit down with your spouse and go, I'm not happy, and I want to take a step or three back, and go a different direction. That means I'm not going to be home again. That means we're going to
Mm,
cut my salary X amount or X percentage. We have to kind of scale back. When you have those conversations more times than not, that gets a bit old for your spouse. So that was a difficult
that's true.
time for sure. And I will say this, I'm on my second marriage, and this probably was one of the reasons. I'm not saying this is the only reason,
Mm,
but this is probably one of the reasons my first wife probably got tired.
yeah,
She's got weary with that, and
yeah,
so that was a difficult time that I had to push through. But I really felt that I was doing no one a service if I pushed forward with oral surgery, which is a great specialty and very fulfilling, and it takes care of people very well, and you can make a good living as an oral
yes,
surgeon. But I just wasn't happy. And it just shows you that money doesn't give you happiness.
right.
And so I didn't want to be that miserable person. So that was one time. The second time was kind of juxtaposed to that, I'm going back to general surgery, or going to general surgery. And now I'm not 26 or 28, I'm 34,
Mm,
and I've already been in the real world, and I've got to take call, and I got to have sometimes guys that are younger than me, but more experienced in general surgery kind of tell me what to do and push me around a bit. And so that was a bit challenging, but you know what? I ended up in a great place at Atlanta Medical Center with some phenomenal, phenomenal people that I'm still in touch with today. And they understood what I was doing. They respected that, but they knew, and I told the line, I played my part. But
hmm.
they gave me some autonomy too. They let me make some decisions, especially as it related to head and neck and oral surgery. A lot of
Hmm.
times I would do the facial fractures and operate as the attending, and they would they would help me. So it was a little bit of a hybrid system, and it made it a lot easier, but it was difficult as an older adult to go back into a training model. It challenged my mental fitness and my physical fitness.
Yeah, absolutely. Well, along those lines, with all those different experiences, do you have any advice for the prospective dental students, pre-med folks, medical students, residents? What words of wisdom would you have for the people who are looking at healthcare or in the middle of it right now?
I would say, and I get young people all the time that come to my office and rotate with me, act as a mentor, and I say, look, this is not a job. This is a lifestyle. And so let me show you what the lifestyle, and let me tell you my stories, and you have to be okay with the lifestyle. There are going to be birthday parties, miss. There are going to
Right.
be, nights that you probably at one point in your career spend more time at the hospital than you do at home.
Hmm.
You have to be okay with that as you're going through, so that you can make it to the next day. So make sure that you do on the front end. My answer is, as a medical student or a young college student, I would make sure I get in front of as many physicians as I can to see what they are doing now, where they've come from, so that you have a really good, accurate perspective of what it took to get there. And are you willing to do that? So that's number one. I definitely would say that. Number two, I would say be true to yourself, and it's okay to pivot. Obviously, I've pivoted a lot. So if you get into anesthesia and it's not for you and you want to go to peds, go to peds. I trained with the guy, Philip Lackey, who's one of our alumnus. He was a pediatrician before he was a plastic surgeon. He pivoted. And so don't be willing to be honest with yourself. Say, this is not where I'm supposed to be. And I have the courage to move forward and do something different.
Sage advice.
I hope so. Hope people will use it. But, like I said, get in front of as many doctors as you can before you make that leap of faith and get as much information as you can, for sure.
Well, I'd love to hear about, you have a lot of practice experience now to go with all of that training and all of that life wisdom. So we'd love to hear a little bit about your practice. What phase do you think you're in your practice? Are you in early practice, mid, late? Are you about to retire? You look so young, you can't possibly be about to retire.
Well,
where are you at in your journey?
I'm really, thanks for the compliment, by the way. Botox.
Just saying facts, just facts. That's all.
I'm really late in my practice, I would say.
Okay.
And if my practice, again, we all have a roadmap in our mind of how we think it should go. It never really goes that way. If the roadmap were as I had perceived, I probably would be at the point I would retire at this point. I am 61 years old. And
you look great.
So thank you. I can't take any credit for that. My parents look really young for a long time before they passed. So that's just genetics. I take no credit for that.
Congratulations.
Thank you.
On the good gene pool.
Thank you. But I'm late in my practice, I would say. And my practice has taken, just as my training took an unusual route, my practice took an unusual route. When I finished oral surgery, and even when I finished plastic surgery, I really wanted to be an academician. My goal was to really be a program director and a chairman. That's really what I wanted to do. I was influenced heavily by an oral surgeon who's passed now, who was a great mentor of mine named Richard Haug, who ran basically the Cleveland Clinic's oral surgery department. And he just was a phenomenal guy and influenced me a lot. So I really wanted to do that. But I never could penetrate the veil and get on the right track to get in that system, as much as I tried.
Plastic surgery is really that way, isn't it?
Yeah, right? It is. It is. It really is. I just couldn't, I wasn't in front of the right conversations at the right time. I don't know what it was, but I just couldn't navigate that road. So I ended up coming back to Atlanta once I finished my plastic surgery. And I wanted to do a couple things. I wanted to, one, because I had taken such a long path, I wanted to get into a practice where I can have a lot of opportunity to operate so I can get my feet underneath me.
Yes.
So I can kind of recoup some of the lost opportunity from, going to training, extra training, so that I can get back stable financially, and get my boards. And so I associated with a guy, I'll just put it that way, with a guy who offered that. And I was able to get a plethora of cases, from hand to craniofacial to burn to aesthetic. And I was able to sit for my boards and pass them, and then get back on stable financial ground. After I did that, I was kind of like, adios amigos. And so go ahead.
I have a follow-up on that.
Sure.
How many people do you and I know that have that exact story? So this is probably more for the plastic surgery people than other people. I didn't happen to have this route, but I know so many people who did, where they go with their, like a kind of a mentor who promises big, delivers small, and then they're like burned out and all angry at the end. And then they're like, forget this. I'm doing something totally different. And this happened to you. This happened to you too, huh?
Absolutely. I think it is more the norm than the exception, for sure.
Which is unfortunate. It shouldn't be that way.
But yeah, it is. It is. You would think that, you would come into a practice and people would your people would mentor you and groom you to, fill the practice and evolve with the practice and add value to the practice, and you would just be there. But our road is a little, again, kind of winding. And so I ended up doing that, and I practiced, and I wasn't quite ready to go on my own. And so I associated with one more guy who I was like, okay, this has got to be the answer. This has got to be utopia. No.
Yeah.
And so I did that for about a year and a half, and I decided, I'm going to just pull the trigger. So I actually ran across with good timing. I got in front of a conversation of a hospital that needed a plastic surgeon, not as a hired employee, but just somebody around in the area that could take care of things for the hospital.
Yes.
A little outside of Metro Atlanta, not technically Metro Atlanta, but just outside.
I
And
just
so,
learned a new term. Would this qualify as a bedroom community or no?
yes, this would
I
qualify
learned
as a
this term at
bedroom.
the ASPS meeting. My friend told me, I was like, that sounds weird. But no, like you sleep at home and work in the city, huh?
Absolutely. So this is
okay.
now that would be a bedroom community. You're absolutely right.
All right. Now
So
you all know, just like I do. We're all learning together.
Exactly. Always students. So I ended up doing that and actually working for that hospital for probably about 3 years. And what that hospital did was great. Like I said, I wasn't an employee. They allowed me to establish my practice. They advanced me a sum of money to do that. And what I needed to do is to be available for 3 years in the area to serve their needs.
Yeah.
And what they would do is then I would have to pay back only on the taxes for that, not the money in full. And so I was able to establish a private practice pretty rapidly in that bedroom community. And I ramped up and grew, and I moved closer to the city and grew. And so I was about 9 years in, and I really wanted to do all the things that we all want to do. I think as private practitioners, we want to get our own building. We want to have our own surgery center. We want to have, a couple of colleagues or partners, and we want to really have, I think most practitioners want a blended practice, but they want it to be top heavy in aesthetic surgery. And so that's
pays
where
the bills, right?
Yeah, pays the bill. Exactly.
Yeah,
exactly. Yeah. So that's where I was going with it. And I was carrying that mountain, trying to get up the mountain myself. And I happened to, be very friendly with some colleagues that were in the next bedroom community, but closer in town. And they're good guys, great guys. And we decided to do a merger acquisition. And then, you know what? I'm going to say this for myself. Maybe I just don't play well.
That is a published old Elvin Zook from SIUE, or no, SIUS, I guess, Springfield.
Yes.
Anyway, he published an article years ago about how plastic surgeons can't make a group work the way orthopedists can.
No, we don't play well in the sandbox together at all. So
yeah.
I did that for about 4 or 5 years. And in 2022, I was still with that group. And we had everything. We had our own surgery center. We had our own building. I was an equal partner, all the things. But, we had then 2020, which happened to everyone. And then within 2020, good or bad, you can paint it either way, I had a spontaneous retinal detachment.
Oh, wow.
Yep. I was sitting in the back. I wore contacts. I thought, it's a long day, busy. Sitting back there, I thought I was pretty tired. I'm really, really tired. My contact must be messed up. I had the evening shade. And so I had it for a couple of days, and I was thinking more neurologic. And I was like, and so my wife said, look, you need to go to the doc. And so I went to my ophthalmologist around the corner from the office at the time, and they kept me for hours, and they were back and forth. And finally they came and said, man, you've got a retinal detachment. You need to go see a retinal specialist tonight. And so I went down and saw that person, and they operated me on the next day. And I was down for couple months, but it was during 2020, so it didn't hurt that much, but a scary time personally, because I don't know how they couldn't guarantee that I would get my sight back at all, and to what
and
degree.
You can't work without it.
Correct. You cannot work without it. So fortunately and blessed enough to get my sight back and had a fantastic surgeon. So that takes me up, to 2022. I'm still with the group, and I suddenly lose my mother. I lost my father on the front end of the pandemic, just before I joined that group, and I lost my mother on the back end of the pandemic. And so with that, losing my father, being in a practice is stressful, just in general for everyone. There are a lot of upsides more than down, but still stressful. Losing my eyesight, the pandemic, and then losing my last parent, was a bit much to take. personally. And so, and then dealing with a practice that wasn't really quite where I think I wanted my practice to be. And I mean that by saying I'm really business focused, hence the MBA. I really try to think more like business people, like the Scott Galloways of the world, if you're familiar with that guy, if you watch podcasts, people who are really innovative in business and how they run and drive business. And I think as doctors, we are working toward that. We're not there yet. And so that was a disconnect. And so I decided in 22 to stop rambling. I decided in 22 just to pause and take a break and really reflect with all the storms that have been swirling around for the last couple of years. What's going on? Who am I? Where am I? And where am I going? Do I need to pivot? Now I've lost both my parents. I have a sister that needs help and is dependent. I have my own family. What am I going to do with my life? And so
do you feel like that was, that was really like a crisis moment, it sounds like.
It was. It was a big crisis. I was dealing with probably 4 of the 5 major stressors that, they're well documented pretty much all at the same time, or at least in succession. And so I almost quit, to be honest with you, in 22. Yes. It's like, because again, practice is hard. I had a blended practice. I did cosmetic, I did insurance, and insurance is tough, and running a business is tough. I was like, I don't know if I have the fortitude to just jump back in it. I just don't know. And so I kind of took a year off. I had the ability to do that. Which was a blessing. Yes. And I did that. And I took that time to really reflect of what type of life I wanted to have moving forward, how I can be intentional in that life. And does plastic surgery fit in that life, or does medicine fit in that life? I could pivot. I have a business degree. Maybe I pivot there. But again, everything has its cross to bear. I could have pivoted in business and it would have been something else. So I basically sat back and took a year off, and I was actually going to move from Atlanta to Oklahoma City. Now, I'm not a big fan of Oklahoma City, and the people in Oklahoma are going to hate me for that. But Oklahoma City, I lived there for 13 years. It's just not the pace I like, but it's done much better. But I was willing to go back to the VA and work at the VA because I was familiar. And to be honest, it was a stable job. It's a government job. And, you get to do some diversity of cases. There's some nuances and some things that, that may rub you the wrong way, but it's a steady gig. Let's just be honest. And it gives you good, interesting cases. And I almost did that, but my wife is from Georgia and she's just not going to do that.
No, she wasn't going to go for that. So you're in this crisis, you have to take care of your family. You have to take care of your sister. Your parents, who you dearly loved, are both gone in a short amount of time, and practice is not where you want. It kind of the depths, you're feeling like Job, maybe. I don't know. A really hard time.
Yes.
What do you, clearly, there's some pull yourself up by your bootstraps kind of stuff,
sure.
but who or what, where are you drawing support from that? Where does that come from for you?
Yeah, it's a great question. It comes from multiple places. Of course, it came from my wife at the time, who really saw, the worst of me. I was really in a bad place, and she was pushing and, saying, hey, you really need to sit down and reflect and talk to somebody if you really need to talk to somebody. I think as men, and I'll just say that, we kind of, resistant. Well, I can just kind of figure it out. I can gut it out. I can be silent and strong and those types of things. And we are, but we all need help. And so she was really a big impetus to say, hey, you talk to someone. So I ended up talking to somebody. So that was one pillar of strength. And then I belonged to a church that when I lived in another part of town, that really I kept connections with. And there were a couple of guys who really checked on me and really say, hey man, how are you doing? Let's go grab some lunch. Hey man, if you need anything, just call me. And I really leaned on them. So I did that. And then my kids were adults, and my girls were fantastic. They would call and say, hey, Dad, are you all right? Hey, I just want to check on you. Yeah, I think that's a great idea if you talk to somebody. So that was a great pillar of strength. And then I just said, this is just a chapter in life. This is not the last chapter. Once I kind of got myself up to a point where I can think about things other than where I was, I said, this is not the last chapter. So what do I want to do? You are in control more than you're not. So go ahead and direct the remaining chapters of your life and be intentional about that. So those were some of the things that I did. And it wasn't as easy, obviously, as I've articulated. It took some time, for me to get there. I mean, and literally I was laying on the couch for 5 minutes at a time, telling myself it's going to be okay. And it's going to be okay. And that turned into 10 minutes, and that turned into an hour, and that turned into, a day and a half a day. And then I was up doing things. So, it was a lot of good people, a lot of good support, and really kind of sitting back and thinking, okay, what do you want to do? You have almost a blank canvas. What picture do you want to paint?
That's beautiful. I think that for the young people who are watching this podcast, I hope they take away some key messages from that, in the sense that if you can be as trained and acclaimed and as decorated as Dr. Earl Stephenson Jr. is, and have crisis like that, then we just all need to acknowledge that that's going to happen to all of us. And leaning into that spiritual support, folks from church, the family support, and realizing the temporary nature of some of those problems. Sure, we have permanent problems, no doubt, but many of them are temporary, and looking to what's coming next. Wow. I mean, just what a great example for people of how to deal with just such a deep problem, and to come through as you are, kind of on the other side of it. Yeah.
Thank you. I appreciate that. Yeah, you're right. I think the take-home message is, no matter, you can do all the great training, you could be on the top of the mountain, life changes on a dime, and then you could be at the bottom of the mountain. And it's important to have people, a support system, whether that's religious or personal, friends and family, to help you through those moments, and realize that this happens to everybody. This is not unique. You didn't do anything wrong, but you will come on the other side of this, and this is temporary.
We've learned a lot about you in your practice, and some ups and downs and some triumphs and all of that along the way. Tell us a little bit about practice now. What's your favorite surgery like? What do you like to do in practice?
Oh, great. Yeah. Great question again. I like to, I'm basically an aesthetic plastic surgeon now. I don't do any reconstructive. I basically focus on a couple of things. Because of my oral surgery, I try to focus on eyelid surgery. So blepharoplasty, I really appreciate that surgery. I think it's an underappreciated surgery. I think people just think, well, just pinch a little skin out and take a little fat and do something. It's more intricate than that, for sure. And so that's one of my favorite surgeries, upper and lower blepharoplasty. I always like tummy tuck. It is probably the most gratifying procedure that I do. You have a lady or a man or a lady, in front of you on the table, and a couple hours later, she's got a totally different silhouette. And it's just very satisfying. And those stories come back in the follow-up. I'm so happy. I can wear this. I feel so much better. I'm just more confident. I feel more sexy, what have you. So tummy tuck is a really, one of my favorite procedures. Occasionally I will do some reconstructive, even though I'm primarily cosmetic. I like to do Mohs reconstruction, and I have a cauldron of, dermatologists have been with me from day one of my practice through all the various iterations. And so I like to do a lot of forehead flaps, and I've fallen into doing a lot of forehead flaps for nasal reconstruction. So
can you kind of show people with your hands what that is? Because if you don't know what a forehead flap is, you're really missing out. But it sounds quite barbaric, but there is literally nothing like it for reconstruction of the nose. Am I right?
Sure. That is correct. So the forehead is a really nice tissue that you can use to kind of rebuild things, particularly on the face, obviously.
Do you feel like, since I have like a 10 head, you could rebuild a lot with mine?
Oh, yeah, we can go way back. We can give you a schnoz for all schnozzes. But
sorry, go ahead.
Forehead flap basically is and a flap is, just so that people know, I equate it to this. It's like a finger. You kind of have loosened it on all sides except for one, and you can use it to kind of move it around any direction you want. So it kind of flaps around. So what we do is we design a flap where we go around, and it's based on a blood vessel here to give it life. And we take that flap up, much like my finger, and turn it down and put it on a wound or a defect of the nose to kind of start to rebuild the surface of the nose, or sometimes the inside aspect, which is the lining of the nose, or in any parts in between. So we use that to do that. And it looks a little funny for a while because you're connected from here to there. And so it's a little scary for patients and their family and people who may not know them, but it is a phenomenal treatment, and it gives, I think, tremendous, cosmetic outcomes. So it's very gratifying.
Yeah, I mean, if you look at the before and afters of some of these forehead flaps, it's like for someone, sometimes you basically remaking someone's whole lower part of their nose or whatever, and they look like nothing was done. It's pretty amazing.
And I got involved. I got interested in that. Really, we had we used to have guest lecturers to come over to Chattanooga. Did you guys have that?
Oh yeah, definitely.
Okay. Yeah. So we had Gary Burgett, who's now deceased, come over. He was a big nasal reconstruction guy, wrote a lot of textbooks and articles, and he came by and did one of our grand rounds or lectures for people who don't, understand what we are talking about. We have, very smart, educated, well-written plastic surgeons in our field come and share their experience. And we just had Gary Burgett come when I was a resident to talk about that. And I really got intrigued by that. And I happened to fall in that into practice. So it really has served me well, and I enjoy it.
Oh, that's fantastic. As far as eyelids go, I also enjoy doing eyelid surgery, and I think that patients really appreciate that. But I feel like there's kind of oftentimes, especially with the upper bleph, there's kind of two reasons that are at work there. And I'm curious if you would feel the same way about kind of what patients tell you and the feedback that you get after you do either a quad bleph or upper bleph in terms of how that changes their face and how they interact with the world.
Yeah, I mean, I think people from my end, you hear the old kind of adage, oh, people always come to me and say, "What's wrong? I'm tired. You look tired. What's going on with you?" And they feel perfectly fine. So they then start to kind of look in the mirror and kind of microanalyze themselves. And so they start to kind of go down this kind of negative path. And so what I found by just a simple upper lid blepharoplasty, just taking out the excess skin, kind of opening up and making them more approachable, more pleasant looking. I think that really kind of injects, a lot of confidence in them, and they stop getting those questions that seem to ultimately irritate them. But it's an elegant procedure that can really change the outcome and the overall appearance to the patient. So I think it's a great procedure. And so that's my perspective. That's on it. And my patients have really been really thankful and happy with just what they think is a very kind of straightforward, small procedure, but it has really big upside, and they're really appreciative of it.
Absolutely. So kind of awake and brighter, and if it's severe enough, they actually can see better too, right?
Absolutely.
Yeah.
If there's a bit of like eyelid droop and a little brow heaviness, and we can address those at the same time through the same incision. There are various ways to kind of treat that for your listeners, but sometimes you can address a lot of things, those things, or all three of those things through that same incision. So it's really a powerful incision, procedure rather. And so it really has a lot of benefit for our clients and patients.
Absolutely. Well, let's talk for a couple minutes. You sent me some before and afters, and so I'm going to start at the bottom one. We'll get our guys to share that. So we have, so we have this gentleman here who on the befores, we can see his starting place on his nose and a big hole in his nose. Is this a forehead flap? What happened for this guy?
Yeah, this is the forehead flaps that we were talking about. So this guy, again, from one of my referrals, dermatology group here in Atlanta, this guy actually had a skin cancer on one side and already had a defect, and kind of walked around with that for a while, and then had
his nose isn't normal to. It's not normal to start with.
Exactly, it wasn't normal to start with. So he just kind of pushed through and said, I'll take care of it at some point. But then he developed a little red spot on the opposite side. And his dermatologist is like, hey, we've got to do something. So he ended up getting that taken care of. And so he had a large wound of his tip of his nose. And obviously he couldn't just walk around with that. He couldn't ignore that. So he was referred to me. And so I decided, hey, look, this is perfect for that forehead flap. So we decided to do a forehead flap, and we do it in a couple of stages or a couple of surgeries. So we do it first by developing or taking the tissue and putting it down on the defect to kind of, I like to have the analogy of bringing sand to your sand castle. So you got buckets of sand, and you got all your sand there, and you stockpile it, and you're going to use that sand to kind of craft. So we brought the buckets of sand, which is the flap, just the skin, and then we let that sit. Yes, it's step one. Yes. And then we let that sit for a couple of weeks, up to a month or two, depending on how I like to judge it, depending on how the flap is doing, how the patient is doing.
And so for the audience, what's happening with our buckets of sand during that time, if I may, is this correct that
Sure.
new blood vessels are going from the nose now instead of from the forehead, and now that nose skin and tissue is becoming that forehead tissue and skin that came from here is now becoming nose skin and tissue. Is that a right way to think about it?
That is an accurate assessment. So what we're doing is we're taking this flap, and it has its own circulation. And we need to make sure that the circulation from the nose kind of infiltrates that tissue and allows it to grow in and become part of the nose. Because at some point, we're going to take off that extra amount of sand that we don't need once we build our castle and get rid of it. And so the sand or the tissue that's left needs to be able to survive. And this allows the nose to provide circulation to that skin so that it can survive. So that's step one, to bring in the sand or to bring in the flap. Step two was then to divide the flap or take out the extra amount that's not necessary, get rid of the extra sand you don't need since you've got all your house built, and then really tailor it or, stitch it in so that it is normal with the anatomy of the nose that was present before the defect. So we really kind of are a tailor. We tailor it in so that it is seamless and it looks cosmetic. So it can be 2 steps. I often have gone to 3 steps. I don't know about you, but I do 3 steps.
I don't shy away from a 3rd step. And when you hear, I was just at our ASPS meeting a few weeks ago, and I just went into the forehead flap lecture because that's just always fun to see and go to. And both guys are routinely doing a 3 when needed. And when your result looks as good as this, you've remade his nose. It's prettier than it was to start with.
Thank you.
You're not going to fault doing a 3rd stage for the rest of your life, walk around where nobody's going to think anything about your nose. It's pretty amazing.
Absolutely. So I have to kind of graduate it to the 3rd step, and I prepare my clients for that. This is a journey. This is a marathon, not a sprint. So we're just going to be ready from the beginning with that. And they've been gracious, and we've got some really nice results. Again, that's one of my favorite procedures.
That's wonderful. What I have next is what looks like maybe to me could be transconj, could be subconjunctival. I don't know in terms of your incision choice, but just a pretty face to start with. And I can see how much more light is in the eyes and how much brighter, and just those bags being gone. Tell us a little bit about this case for this patient we have here with what I believe looks to me like a blepharoplasty.
Yeah, it is a lower lid blepharoplasty or a lower lid eyelid for those of you, again, not the $1 million words. So this is a very pretty lady. And so we want to keep that in mind. So she has a little bit of excess skin from the puffiness, as you can see, and kind of had some of the same complaints that we talked about. Hey, she's got it put together in all aspects, but, people come up and say, hey, you look tired. Are you okay? Are you getting enough rest? And she just, that kind of wears on her. So she presented to me, and she had actually seen another plastic surgeon who wasn't really comfortable with that because she's a person of color. So concern about scarring and hyperpigmentation. And sometimes people get concerned about keloids, and rightfully so. In my experience for the face, especially the eyelids, I've not had that problem because the eyelid skin is just naturally different and a little bit more delicate.
Yes.
But then again, rightfully so, that plastic surgeon was a little worried because that's not their area of specialty and expertise. And so they
Right.
referred them on. And so I decided when sitting down with her, I said, look, I hear your concerns. I hear the concerns that you've articulated for me from the previous plastic surgeon that had now made you a little bit more nervous. I think you have some loose skin, but I think it's mostly due to the fat. I don't think we need to treat the fat. And the way I look at this for your audience, there are three components mainly, and I'm being very general. You've got the skin that can be a problem. You've got the fat that can be a problem. And you also then have the tonicity or the laxity or lack thereof of the eyelid itself. So those three things are really at the front of my thought process. So for her lid tightness was pretty good. She didn't have a really floppy lid, so I didn't have to talk about addressing that in a very formal way. She does have a little puffy skin. Yes, we all can see that, but it's not enough that I think I need to make an incision on the outside to remove. Nor do I need to add some type of energy, like a laser for people who don't know, to kind of shrink or tighten the skin. I really thought this was just the fat that was really kind of protruding forward. And so I said, this is what we're going to do. We're going to make an incision inside the red of your eye so that we can hide it. So there are no external incisions. We're going to take out fat. We're going to redistribute fat. We're going to kind of melt away fat so that we can get the nice contour from your eyelid to your cheek so that no one will know. And so I ended up doing a transconjunctival blepharoplasty, again, the $1 million word, right through the eyelid, took out the fat, repositioned from fat, put a stitch in here, closed it up, and let her heal. And this was her result.
Beautiful. I love that. Our last person is an unusual case, I'm guessing, at least for me, and probably for you as well. Patient goes from having, I'm guessing, a surgical misadventure, probably somewhere else, and just having all kinds of trouble in her tummy. And then in her after picture, she looks totally normal, lovely. What's going on there?
Interesting story. You're right. This is what I love about plastic surgery. This is where you get to be a chef and not a cook. You get the ingredients in the basket you get, and you got to make something out of it.
Yes.
So this young lady is unfortunate, and this is a kind of a cautionary tale. We have a lot of competition in Atlanta for aesthetic surgery. I'm sure you do in Missouri. She was in the wrong hands of a practitioner who's not trained as a plastic surgeon. So she had a BBL liposuction. She ended up having necrotizing fasciitis and was septic and multi-system organ failure. Again, big words. So for your audience, she was very, very sick. She was in the ICU. All her organs were not working properly, and she was going to die. And so one of the guys I trained with in general surgery saved her life. He did the debridement. He got her kind of resuscitated and saved her life. But she ended up with this horrific scar in her 20s. And so she bounced around the city and ended up going back to him and say, hey, I just want somebody to talk to me about this. So he referred her to me. And so when she comes into my office and tells me the horrific story, I was like amazed that she survived and she was doing well from that standpoint. But I was like, wow, thinking to myself, what am I going to do with this? I don't want to just take this out, I don't have enough skin. So I just used our principles. Again, it's the basket. I got a basket. What am I going to do with it? So
That's plastic surgery 101, right? We're a principle-based specialty.
For sure. So I said, look, I need extra skin. How can I get extra skin? Well, I can expand the skin. And so what I told her, I said, look, this is a marathon, not a sprint. We're going to place some balloons underneath your skin, one above your belly button, one below your belly button. And we're going to stretch out the skin very thoughtfully, on a weekly basis, 2-week basis, to get extra skin above that scar. I don't know where your belly button is. You may have one, you may not. We'll see. But we need the extra skin so that I can go in and take out that wide scar. And then take that excess skin once I remove those balloons at a second surgery and pull that skin down almost like a tummy tuck. So that's what I ended up doing. So the first surgery, I placed 2 expanders. I expanded her over about a 3-month period. Went in to remove the scar, and I was a little concerned about the scar. The scar was really plastered to the fascia. So I didn't know I was going to get into the fascia, past the fascia, and what I was going to find. But fortunate enough, it was just down in the fascia, and I was able to get that off. So the fascia, for your audience, again, is the next layer above the muscle. So it's like a little leather covering. So I was able to peel the scar off the leather covering, took out the balloons. I found her belly button, which was
lo and behold
there and viable. It was healthy. And so it became then just a standard tummy tuck. I just pulled down the extra skin, removed it, sewed it together, brought her belly button through, put drains in, and we were on our way.
That's a home run. Congratulations. Congratulations to you and the patient. That's fantastic.
She was really happy. Again, it's just, it lends itself to, like you said, we just have to think a little bit outside the box, use the tools that we have, and just kind of craft unique and individual treatments for each patient. It's not rubber stamped.
So you have a podcast, Kids Plug Your Ears. A podcast is called TNA Plastic Surgery. What does that mean? What's that all about? He's got a strong social media presence. We want to hear about it. Dr. Stephenson, what's going on there?
So, it's Kids Close Your Ears. It's a little cheeky here. So it's called Plastic Surgery TNA, and that's a little bit of a play on words. And we, just for top sides and back sides, I'll put it that way. I don't know if this is G-rated or not, but I thought it was a catchy.
It's funny.
I thought it was a catchy title, because I wanted to kind of have people stop and go, oh, TNA. So what's that all about? And thought it'd be a little bit salacious. And occasionally we are a little salacious when we have to get down and gritty with it. But really, it was almost a challenge by one of my old clients. As I started this new version of my practice, I realized one of the clients I operated on and had done a mommy makeover was a marketer. And so as I was getting up, as we talked about earlier, kind of getting myself back on footing after kind of the vortex that I went through, she's like, you need to have a better social media presence. I think you need to get on camera and just start talking. And I don't know about you, Caleb, but that's not innate for us doctors to just kind of get up and start talking. And so I just did it, and started doing it. And it started to become a little bit more routine. And I need a lot more polishing for sure and dressing up. But I just started doing it. And then what I wanted to do once I kind of got comfortable with being in front of the mic is really to be impactful. Obviously, there are ways to catch attention. And I'm not saying they're good, bad, or indifferent, but you can be kind of silly, you can be kind of serious, you can be in between. What I wanted to do is to be kind of a little bit of a thought leader and be educational to the patient, because patients don't really know what's going on out here, and it's hard and it's confusing. And so I like to speak from, I would say, the voice of authority, being, appropriately trained. Hey, I would love for you to come with me and come work with me, but in case you don't, this is what you need to look for. So I thought this was a good vehicle to put that message out. And so I started doing that. And so I just use that primarily as my social media. I think that's really, in my estimation, very powerful. So we just kind of fell into it, and we try to grow and learn and do better each and every episode.
We have had such a joy having Dr. Earl Stephenson Jr. here with us today, board-certified plastic surgeon by the American Board of Plastic Surgery, member of the Aesthetic Society, renowned plastic surgeon in the Atlanta area. And what closing thoughts do you have for us? What would you like people in your area and around the country to know about your practice? And the floor is yours. Final word.
Okay, great. Thanks. Again, I appreciate being on. It's been my pleasure. Couple thoughts. I'm a plastic surgeon that values your experience. I'm well trained, just like all my colleagues. But the difference, I think, in my practice is the way you're treated. We go out of our way to make sure that there are really no impediments to me. You can get a lot of direct access to me to make sure that your journey is a safe journey and that you feel cared for during your journey. And we're here to help you. If you're interested, we're located in Atlanta, just north of the city. And you can always check our website for the procedures that we offer. Again, that's www.esjaesthetics.com.
If you enjoyed today's conversation, be sure to subscribe so you never miss an episode. You can learn more about my practice, explore additional educational resources, and find all of our podcast episodes at calebsteffenmd.com. You can also follow along on social media at Caleb Steffen MD for surgical education, behind-the-scenes content, and updates on future episodes. If you found value in today's discussion, we'd be grateful if you left a rating and review on your favorite podcast platform. Your support helps us reach more surgeons, trainees, and anyone interested in the field of plastic surgery. Information shared on this podcast is intended for educational and informational purposes only. It should not be considered medical advice and is not a substitute for consultation with a qualified healthcare professional. The opinions expressed by guests are their own and do not necessarily reflect those of Dr. Caleb Steffen or this podcast. If you have questions about your own health or medical care, please consult your physician. See you next time.